Each year, the March of Dimes researchers know how many babies in this country are born prematurely and their fight to live and grow.
But for the first time, the report is also looking into how many babies die because they were born premature. It found 2 babies die every hour. Women of color are up to 50% more likely to give birth preterm, and their children can face a 130% higher infant death rate. Rosalia Hernandez sat down today with the CEO of the March of Dimes for a look at how Texas is doing.
And in Texas, it's even more dire for women of color to give birth all over this country. Why is that?
We know that there are many, many women in Texas who are uninsured, especially low-income women, especially women of color. All of these things really contribute to increased risk of poor outcomes, leading not only to babies being born too sick and too soon, as we see in the premature birth rate, but also women dying as a result of pregnancy and childbirth, which happens far too often for women in this country, and especially for women of color.
At a time when the country is dealing with systemic racism and the effort to change that, is this part of an effort to change what at the core is disparities when it comes to women of color giving birth?
There's no question about it. We have so many systemic failures in our healthcare system, one of which is the issue of racism and discrimination that exists within the healthcare system. There have been many studies to show that the impact of implicit bias is actually also a factor in how women receive treatment and care, especially women of color. And so we also at the March Dimes are asking for more and more action to be taken.
What needs to happen at the state level?
So one of the things that is really critical is the expansion of Medicaid. Medicaid covers over 40% of all babies born in this country. And in states that have not expanded Medicaid, that is where we see some of the worst outcomes with respect to preterm birth and maternal health. Texas has not expanded Medicaid, and what we're also advocating for, in addition to expanding Medicaid in general, is making sure that Medicaid can cover women postpartum at least up to a year.
After examining the data, March of Dimes gave the United States a C- grade. Texas got a failing score, a D, based on premature birth rates. Our investigative team looked into the reasons why hundreds of women die from pregnancy or delivery complications every year in Texas. You can read more on that by searching for Mothers Erased on our website, kxan.com.